Hi, my name is Tracy Matusko, and I'm a health educator with Humana.
Hi, everyone. My name is Abby Ewing, and I'm also a health educator with Humana.
Please keep in mind that this information is provided for educational purposes only. It is not to be used for medical advice, diagnosis, or treatment. Consult your doctor if you have questions or concerns. Today, we're going to be talking about the intersection of technology and healthcare. Telehealth, sometimes called telemedicine, is the use of technology to access healthcare services remotely. Telehealth is an umbrella term that includes any health-related services using phone and video technology.
And while telehealth can refer to many things, the way many people use it is to allow a healthcare provider to care for them without an in-person office visit. So telehealth is done primarily online with internet access on a computer, tablet, or smartphone.
So for examples of telehealth, for many people, the words telehealth and telemedicine conjure images of people meeting with their doctor over a computer or device. And while that is a big part of telehealth, it's actually so much more. Let's talk about some examples of telehealth that you may be familiar with or may have even used yourself.
So the example of telehealth many of us are more familiar with is having a doctor visit using the phone or computer. And this may be a simple conversation over the telephone, or it may be an online face-to-face visit using a smartphone or computer. Another example of telehealth is using your smartphone or other device to upload food logs, medications, and blood sugar levels for review by a nurse who responds electronically. And some healthcare providers use things like this to understand what factors may be affecting your health.
And another example is actually something called an online patient portal. Now, here you can see your test results, you can schedule appointments, you can request prescription refills, or you can chat with your doctor. Some even remind you when it's time to get preventative services and vaccines, like your flu shot. Like the earlier example, some people use apps on their tablet or smartphone to keep track of how much they eat and exercise, or to remind them to take their medications. There's an app for almost anything nowadays, and these can be helpful tools for managing one's health.
There are many benefits of telehealth, but one of the biggest is something that many of us have experienced over the last couple of years, and that's social distancing because of COVID-19. And so as the need to stay home grew, virtual visits for medical care provided a way for people to access care without having to leave their home.
In addition, telehealth and telemedicine also can help for those that may have accessibility issues living in rural or isolated communities. It can make services more readily available or convenient for people with limited mobility, time, or transportation options. It can improve communication and coordination of care among members of a healthcare team and their patient. And they can provide support and tools for the self-management of healthcare.
So you may be wondering now what types of visits can actually be done virtually. And according to the Mayo Clinic, telehealth visits can address a range of health needs. So one common reason people may use telehealth is to receive urgent care for quick diagnosis of conditions like sinus infections or rashes. Other reasons may be for counseling services, diabetes management, and consultations with specialists.
However, some health issues require in-person care. Examples include things like abdominal pain, a broken bone, or possible heart attack. For these and other issues, you may need lab tests or other tests, and in some cases, emergency care. As a rule, Always seek emergency care when needed.
And so the next question you may be asking yourself is, how do virtual visits compare to standard in-person visits? And the short answer is pretty good. So according to the Mayo Clinic, many people report a positive experience with virtual visits. And in fact, a 2019 study published in the American Journal for Managed Care found that when comparing virtual visits and in-person office visits, 62% of patients reported no difference in the overall quality of the visit, and 21% said it was even better. In fact, virtual visits were vastly preferred to in-person office visits due to the convenience and travel time.
So, virtual visits can work in a variety of ways. It may be dependent on the type of service you're seeking, your insurance provider's contracted telehealth company, and your healthcare provider's way of doing things.
And so many healthcare practices provide virtual appointments that allow you to connect with your personal provider via online video conferencing. And so these appointments enable you to receive ongoing care from your regular doctor when an in-person visit isn't required or possible. So if you aren't sure whether your doctor offers these virtual visits, just ask them. And in general, you will need to schedule an appointment for your virtual visit with your doctor like you do for an in-person visit. And so to find out, check your practice's information online or call them directly to learn about your options and information you might need for your appointment. If your practice does offer virtual visits, you will receive instructions on what equipment you need and how to connect. In general, you'll just need your smartphone, tablet, or computer with a working camera and speakers and a strong internet connection.
In addition to virtual visits with your doctor, you may have heard of on-demand visits. Some companies and health systems offer virtual visits for counseling or urgent care that do not require an appointment. So these on-demand services may be available as part of your health plan, or you might access them through a private company. These visits often require you to download an app where you create an account and are guided through a series of questions. These questions are related to your current symptoms, as well as any other relevant information about medications you're taking or diseases you're managing. After completing the questions, you'll be put in a virtual queue until a doctor or nurse practitioner can see you. He or she can prescribe medications, suggest home care strategies, or recommend additional medical care.
And so these services, they're convenient, but they do have drawbacks. So for example, treatment received may not be coordinated with your regular doctor. Additionally, important information related to your medical history may not be considered, and these visits may not be optimal if you have a complex medical history.
Telemedicine has been around for a long time, but it's experienced a sharp rise in popularity due to the COVID-19 pandemic. This is according to the Mayo Clinic. You may have additional questions about the ins and outs of telemedicine. Let's talk about two common questions now. The first one is, are virtual visits covered by insurance? And two, are virtual visits secure?
All right, let's answer those questions. So virtual visits may or may not be covered by your insurance. Every health plan is different, and every plan may cover different types of telehealth services. So a good strategy is to call your insurance company if you have questions or if you're not sure whether these services are covered.
So the other concern is about security with the virtual visits. Now, according to the U.S. Department of Health and Human Services, medical centers are required to use strict privacy measures to protect people online. Telehealth technology uses encryption to protect your privacy and create a secure environment for communicating. Encryption makes your data unreadable to anyone else on the internet.
Okay, so now let's talk about some tips for preparing for a virtual visit. So we have a better idea now about how virtual visits work. So let's go over these tips. You want to keep in mind that virtual visits are a lot like in-person visits because you get more out of it when you plan for your visits. So first you want to find out important details you need to know from the provider, including how much the visit will cost. Next, be ready to talk about the reason for your visit, including any new or changed symptoms. A good tip here is to write these symptoms down. And you don't want to rely on memory on the day of the appointment, right? So write those symptoms down. And speaking of writing things down, you also will want to make a list of questions that you'd like to ask your doctor. And you should also have a list of all the medications and supplements you take handy.
And in addition to creating a list of the symptoms, questions, and medications, it's important to prepare your technology and the space you'll use for your virtual visit. First, make sure you read the instructions for getting connected well before your appointment. Download any software you need ahead of time and let the office know if you don't understand. You may need to register for the appointment beforehand, depending on the provider or the service that you are using. Next, find the right space for your visit. It should be a quiet area in your home with strong Wi-Fi or mobile data where you won't be interrupted. Lastly, make sure your device has a working camera, speakers, and microphone. Set your device's camera at eye level to help make it easy for your doctor to see and talk with you. Turn the volume up for your speakers too.
What happens after your virtual visit? So let's go over some best practices for this. Directly after your virtual visit, it's a great idea to write down key takeaways from your doctor while the information is still at the top of your mind. This is a good way to recap the appointment and think about your next steps. And also be sure to follow up as your doctor requests. So for example, you may need to schedule another virtual visit or an in-person visit for lab tests, imaging tests, or a physical exam.
Always reconnect with your doctor if anything changes or if you have any questions. And always ask about the best way to reach your healthcare team if you need to get in touch. Your doctor may prefer you schedule another online visit, call the office, use email, or communicate via patient portal. With so many options available, it's important to ask which one is the best for your provider.
So if you're considering making a change but aren't sure where to start, we are here to help. The Humana Neighborhood Centers are committed to bringing you the information and services you need to help you reach your health and wellness goals, whatever they may be. So first, we offer appointments with our health educators, both at our physical locations and over the phone. Our health educators may be able to help you learn ways to improve your physical, mental, and emotional health. Next, if you are a Humana member, you can visit us in person to speak with a customer service representative about questions related to your plan's benefits, bills you've received, instructions on how to find an in-network healthcare provider, and more. And lastly, we host health education programs in person and online. During these classes, you can learn about a variety of topics, including chronic health conditions, nutrition, mental and emotional health, and more. So to learn about more of any of these services, please call your local Humana Neighborhood Center, or you can visit us at humananeighborhoodcenter.com.
Have a great day, everybody.
Thank you, everyone.